Hello, welcome. I'm Dr. Bob Basu. Today on Behind the Double Doors, we're talking about rhinoplasty, all things about the nose, with our newest team member, facial plastic surgeon, Dr. Taylor DeBusk. Welcome, Dr. DeBusk.
Yeah, thanks for having me.
So let's start with your background and training in rhinoplasty, because that's a really specialized skill in plastic surgery. Can you tell our listeners a little bit about your experience before joining us at Basu Aesthetics and Plastic Surgery?
Yes, so I did my head and neck training up in Minnesota, which is a center that had a high volume of rhinoplasty surgery, both for a functional rhinoplasties as well as cosmetic rhinoplasty. So did hundreds of rhinoplasties there. Then I went to San Francisco to do my fellowship, where again, the majority of my experience there was rhinoplasty, mostly cosmetic out there. So I have pretty extensive experience with rhinoplasty, both from a functional standpoint as well as an aesthetic.
That's awesome. So can you tell us, why are you passionate about the nose?
Yes. So I love rhinoplasty. It's by far my favorite surgery or procedure, mainly because it can be extremely transformative. The nose is obviously in the center of the face, and it's nothing that you can hide. And there are really limitless options to what you can do to change the overall shape. And every move that you make, you have to think kind of 10 steps ahead, because obviously the nose is a three-dimensional structure. So you have to make sure that the changes you make look good from every angle. So it's technically challenging, yeah.
So definitely millimeters matter.
Oh, for sure.
And I think your experience in head and neck microsurgery definitely comes into play here, right?
Oh, definitely. Because the nose, especially once you get in there and start making all these, millimeter, sub-millimeter moves, you have to be able to, or be comfortable making those small augmentations, very similar to microsurgery.
So rhinoplasty is one of the most common procedures in demand in the United States and quite frankly, worldwide. What are the most common things patients come to you to make better?
I would say the number one thing is the nasal bridge or the nasal hump. That's probably the most common cause or request for patients, is to take that down, give the nose a much better contour, improve the patient's profile. It does significantly change the way the nose looks.
Are there any other concerns that patients present to you quite commonly?
Yes, just behind that, I would say, is the nasal tip. So, a lot of patients want to improve the contour of the nasal tip. Some patients have what we call a bulbous nasal tip, or kind of that ball shape at the tip of the nose. And a lot of people want to address that and, again, improve the contour and the overall aesthetic appearance of the nose.
What about patients that are concerned about aging? Some patients feel that their nose grows as they get older. Is that true?
That is actually a pretty common question or concern, but the nose doesn't grow. Like gravity affects other parts of the body, gravity affects the tip of the nose. So with time, you get laxity of the ligaments on the inside of the nose, which causes the nose to start to droop, which gives it kind of that, aged appearance.
On the other end of the spectrum, can you have a rhinoplasty at any age? What's the youngest age you could consider for a rhinoplasty?
Definitely. So typically, you don't want to go under the age of 17 for females, 18 for males, if you're looking at a either functional or strictly cosmetic rhinoplasty. There are some exceptions, particularly patients that have a history of cleft lip or palate, because the development of the palate and the upper lip has a significant effect on the overall shape and function of the nose. But in general, 17, 18 is the youngest that you'd want to go.
So as we know, patients go online to get their information, and there's all kinds of different techniques out there for rhinoplasty surgery. So can you walk our listeners through what some of the different options are and what you prefer and why?
Yeah, definitely. So there are two main approaches in rhinoplasty surgery. One is the closed approach, and two is the open approach. With the closed approach, all the incisions are made on the inside of the nose, so there's no visible scar. On the open approach, there's only a 5 millimeter, 4 millimeter incision at the base of the nose, of the columella, and that's the main difference in the incision placement. Now, the access to the underlying cartilage and bony framework is much easier to manipulate with the open approach, because you get direct access, direct visualization of all the different parts of the nose. Whereas with the closed approach, your access is limited. So for me, I personally like the open approach better, because it helps me to make those changes and have a little bit more of a predictable outcome.
So oftentimes, patients seeking nasal surgery, they're okay with the appearance of their nose, but they can't breathe. Dr. DeBusk, can you tell us what might be going on with them?
Yeah, so this is very common. So with the nose, there's something called the septum, which is basically a midline partition or a wall that divides the nose in half. And if that septum is deviated at all, it can cause significant obstruction and really result in minimal airway movement through the nose, which causes people a lot of distress. So one thing we can do is we can address the septum completely independent of the rest of the nose to remove the deviated part so that people can breathe completely through both nasal passages.
And do you need to bring cartilage from somewhere else to do that work?
No, typically not. It can depend on the severity of the deviation, but typically with a septoplasty, you're really just removing the curved or deviated piece of the septum.
And do you often treat the septum or perform a septoplasty during a cosmetic rhinoplasty?
Definitely, because usually when I'm doing a cosmetic rhinoplasty, I am removing a significant portion of the septum to use that cartilage for grafting purposes to kind of change the contour of the cartilage. So very often I do a septoplasty in conjunction with a cosmetic rhinoplasty.
Patients often present with a concern that they've got a crooked nose. How do you evaluate that and how do you treat that?
Yeah, so definitely. So when we look at the crooked nose, you have to take into account three portions of the nose. So the first is the bony pyramid or the top of the nose. So you have to address whether or not the shape of the nasal bones is causing the nose to be crooked. Second, you have to look at the midvault or the middle portion of the nose to see if the septum or the cartilaginous portion is deviated. And then third, you have to look at the nasal tip because sometimes asymmetries in the tip can give the appearance that the nose is crooked, where in reality, everything on the inside is straight, but the cartilage of the nasal tip is asymmetric, giving it that crooked appearance.
What about for patients that have had trauma? Let's say they've broken their nose. How can you help them?
Yeah, so it depends on what's affected in the trauma. If it's just the nasal bones, just the cartilage of the nose, or a combination of both. If the nasal bones are affected or broken, typically you want to intervene or reduce the fractures within the first 2 weeks. The longer you wait, obviously the bones start to grow back in the wrong position, and eventually you have to go back in there, break the bones, and reset them. Now, if the cartilage is affected, it depends where the cartilage is affected, you may have to do an open rhinoplasty to support or rebuild the inside of the nose.
So every case is unique, and Dr. DeBusk has to evaluate what's going on to figure out what the solutions are. So a common concern for patients when they're thinking about any surgical procedure, including a rhinoplasty, is the recovery. So can you tell our listeners how long does it take to recover from a rhinoplasty and when can you start going out and about?
Yeah, totally. So kind of the overall post-op process. So 1 week after surgery, we'll see you back in clinic, remove stitches, take the cast and splints out and off. And your nose is very, very swollen. And I try to tell every patient and reinforce the fact that at 1 week, the nasal tip is very edematous or swollen, and it does not look anything like what the final product will yield. Then at about 4 weeks, there's a dramatic improvement in the post-op swelling. And I always tell patients, when you're walking down the street, nobody will have any idea that you had surgery. But when you look in the mirror yourself, you'll still be able to tell that the nose is swollen. Then once we hit that 4-month time frame is when the majority of the swelling is gone and you get an idea of what the final product's going to look like. But to be honest, it takes 12 up to 18 months for the nose to be completely healed after surgery.
Mm-hmm. Now, is rhinoplasty different for Asian or African American patients?
It is. And two main reasons that they're different. One is the skin thickness. So everybody has different consistencies of their skin. So typically, the Asian and African American rhinoplasties, you have to address that thickness of the skin or take that into account. And then two is the consistency of the cartilage. Again, typically Asian and African American rhinoplasty, there's less cartilage to work with, one, and the consistency is softer, or the cartilage is softer. It's not as rigid. So you have to take those into account.
Mm-hmm, mm-hmm. Now, let's say someone wants to improve their nose, but they're just not ready for surgery. Are there any non-surgical options for a patient to change the shape of their nose?
Definitely. And so it's called liquid rhinoplasty, and that's kind of becoming more and more popular. And what liquid rhinoplasty is using filler in the nose, but doing it conservatively. It's a high risk procedure potentially because there's a lot of vascularity to the nose. So when you're injecting filler, you have to take that into account. But we use filler a lot, mainly to address some of those dorsal humps, to smoothen out the nasal bridge and to do kind of fine tuning of the nasal tip as well.
So in terms of online stuff, to follow up, I'm hearing a lot of patients asking about preservation rhinoplasty. What is preservation rhinoplasty?
Yeah, so preservation rhinoplasty, it's kind of making a swing back into popularity. What it is addressing basically the nasal hump or the dorsum without actually separating all the underlying cartilage and removing bone from the top of the nose. So when you think about the nose, it's kind of the shape like a pyramid. So traditionally, and the way I approach the nose is by, if you want to adjust the top of the pyramid, you can address it directly. Whereas with preservation rhinoplasty, if you want to address the top of the pyramid, you actually are augmenting the base of the pyramid. And we used to do this a long time ago within facial plastic surgery, but the results were not as predictable. But now with the addition of what we call ultrasonic technology, it's basically a drill that can address the bony aspect of the nose without causing soft tissue damage. So the introduction of this new technology has made preservation rhinoplasty kind of come back into the limelight.
Interesting. So Dr. DeBusk, when you're treating a primary rhinoplasty or someone having a rhinoplasty for the first time, how long does that typically take you in the operating room?
Yeah. So again, it kind of depends on what we're going to address, but usually I say it's about 2 hours, 2 to 3 for a standard primary rhinoplasty. But again, it really depends on the overall plan.
And this is outpatient surgery, correct?
Correct.
So we talk about what patients are reading online. What advice do you have for a patient that's been thinking about a rhinoplasty? What should they do?
Yeah. So number one, do your homework. I recommend or advise patients seeing somebody that does a lot of rhinoplasty, that rhinoplasty is a majority of their practice. Because again, it's a highly technical surgery or procedure. So you want somebody that is comfortable doing the surgery, number one, and then able to give you the results that you're looking for.
And I think Dr. DeBusk is being humble. When he talks about someone that specializes in rhinoplasty, what he really should be saying is that he is the true specialist in rhinoplasty. And that's why I'm so excited to have him as part of the Basu Aesthetics and Plastic Surgery team, because he's going to really bring best-in-class options for patients who are seeking changes to their nose. So Dr. DeBusk, one of the things I'm really excited about is we always strive to be best in class in everything that we offer our patients. And I'm excited to be able to have our patients meet with you and get care from you for their rhinoplasty, because I think you provide best in class care for rhinoplasty. But you're very talented, and we're really proud we were able to recruit you to Basu Aesthetics. But you were looking at a lot of different options. Can you tell our listeners why you chose to join us?
Yeah, definitely. One of the reputation that you have developed obviously was very appealing, and then your skill set. And the two is the fact that you have your own operating room as well as MD anesthesiologist with the practice. So it's unparalleled care for patients, which was extremely appealing to me and why I wanted to join.
Well, thank you, Dr. DeBusk. And if you want to learn more about Dr. DeBusk, please visit us at basuplasticsurgery.com or follow his results on our Instagram at Basu Plastic Surgery.
Thanks for having me.
Basu Aesthetics and Plastic Surgery is located in Northwest Houston in the Town Lake area of Cypress. If you'd like to be a guest or ask a question for Dr. Basu to answer on the podcast, go to basuplasticsurgery.com/podcast. On Instagram, follow Dr. Basu and the team at Basu Plastic Surgery. That's BASU Plastic Surgery. Behind the Double Doors is a production of The Axis, THEAXIS.io.